infertility. It's not always an easy topic to discuss, even with those who are closest to you.
Yeah, infertility can have an intense emotional impact on women and their families, and knowing what to say to someone struggling to conceive can sometimes be incredibly difficult, right? Joining us now is OBGYN Dr. Lucky Sikon. She also with us is psychotherapist Robbie Ludwig. Dr. Lucky, I'll start with you. So infertility, it's not just a medical diagnosis. Talk to us about how it can affect sort of all aspects of somebody's life.
It's such a mental health issue as well, because it's one of those types of chronic medical conditions that are invisible. So people are often struggling in silence. So there's a lot of isolation. There's a lot of self-blame as well, particularly on the side of female infertility. I think society has traditionally told women that this is a female problem, but we know that that's far from the truth. Infertility affects men and women equally, and that's why it's so important for couples to both be evaluated at the time of a diagnosis. It's also something that can be very triggering in social situations, because not everyone has had any experience with it. And so they may not know the right thing to say. And that's why it's so important to have conversations like this.
And you hit the emotional toll so well. So Robbie, I'd love to hear from you. So many of us likely know someone dealing with infertility, trying to navigate that challenge. What do you recommend maybe we say and we don't say?
We don't say. So it's really important to have empathy for the friend who's going through infertility and to ask them open-ended questions. How are you feeling? How are you doing? And to offer pragmatic help. Like, is there anything that you need from me? Please let me know if I can, be an ear to listen to you, a supportive ear. And it's really important not to assume and give advice that's unsolicited. You don't want to say, hey, maybe you should adopt, or have you thought about surrogacy? Because it is an issue of grieving that people feel. Like, there's the grieving of the frustration. So you don't know where a person is on their journey, and they may take something really hard, even though the intention is well-intentioned.
Yeah, and infertility can be hard. I think even for the person who's going through it, it can be hard to raise it and talk about it out loud. Do you have any suggestions if somebody out there is dealing with infertility?
Well, I think people often underestimate the mental health burden. And I tell every patient of mine at the beginning of their treatment journey, you may feel up for the challenge right now and confident about your mental health, but infertility treatment is often not a sprint, it's a marathon. And the number one thing that is important for people to realize is that IVF dropping out from treatment prematurely, is often the thing that gets in the way of people reaching their successful outcome. And the number one cause of dropping out prematurely is psychological distress. So arming yourself with all the tools, getting a therapist, talking to your friends, really communicating and taking care of yourself physically. Self-care is so important to resilience and really building up your mental health strength.
Yeah, you're really talking about a long game in this journey. Robbie, I heard you mention grief. Can you walk us through maybe some of the other emotions that might come up in this process?
Sure. Depression, anxiety, self-blame, isolation. And they really have found through clinical studies that a combination of mind-body interventions along with cognitive behavioral therapy, support groups can all help with the process in terms of leading to a successful outcome.
And, I think there is this tendency to maybe blame yourself if something is going wrong. To both of you, what would you say, that you wish women understood more about infertility?
Well, I would say that it's a very complex issue, and to not engage in self-blame, to just be where you're at and get the support that you need. I don't think blaming is helpful. These things happen, illnesses happen, frustrations happen. So just knowing that it is, normal for some people, and just there's help out there.
And unlike a lot of areas in life where the amount of effort you put in equals the result, this does not apply here, right? So people who are the picture of health, they're doing everything right, they're eating healthy, they're exercising, they feel like this is something that should never have happened to them. And I explained to them that it's completely out of their control.
Right, to that end, Dr. Lucky, can you remind us of sort of the factors that contribute to infertility?
Well, age can be a major factor, right? And people are often very surprised to learn how inefficient human reproduction is at baseline and how much age can impact that process. But there's so many other factors, right? Sperm health is a major one. I know we've been talking about Men's Health Month, but also there could be blockages in the fallopian tubes. A lot of common gynecological conditions like fibroids, PCOS, endometriosis, to just name a few examples.
Yeah, as you said a few minutes ago, it's not all about the woman. It can be also about the partner. Yeah. Thank you both so much for being so open and talking about all of this, Dr. Lucky Sikon and Robbie Ludwig.
It's an important conversation.
It is.